So this woman went in for a medical treatment and never came home. Here's her story. Have you ever been scheduled for a medical test like an MRI, and your doctor gives you something to calm your nerves so you don't feel claustrophobic in the machine? But imagine this. Instead of a mild sedative, you're actually given a drug that shuts down every muscle in your body, including your lungs. That's exactly what happened to this woman named Charlene Murphey. She was at one of the best hospitals in the country. Yeah, not exactly the kind of mistake you expect at a top-ranked medical center. The story takes place in December 2017 at Vanderbilt University Medical Center, a well-known medical center in Nashville, Tennessee. Charlene was almost ready to go home after being treated. She just needed one last PET scan before discharge. Her doctor ordered her Versed. It's also known as midazolam. It's a sedative that's used every single day to calm patients down. Very routine when you're getting a scan, especially if you feel nervous or you're claustrophobic. It's very common to get this. But when the nurse went to the automated medication cabinet, she typed in the letters VE. And here's the problem. 2 drugs popped up. Versed, the sedative the patient actually needed, and Vecuronium, a powerful paralytic that stops all of your muscles from working. Instead of pausing or double checking, the nurse overrode the safety system. You know, like we all kind of do. We just click accept on the iPhone, terms and conditions. It's kind of what we do in this day and age. And a lot of providers, you see so many warnings, they often just override them all the time. Because a lot of times they're not a big issue. Except this time, the consequences were deadly. So things kind of went sideways. She grabbed the Vecuronium, injected it, and within minutes, the patient's lungs shut down. The patient couldn't call for help. She couldn't breathe. She went into cardiac arrest, suffered brain damage, and later died, all because of the 2-letter typo and override. This wasn't just one nurse making a mistake. This was kind of a chain of system failures. Look-alike, sound-alike drugs are an issue. There is a culture where overriding safety warnings was considered normal, and no mandatory double check for a drug that can literally stop someone's heart, stop them from breathing. The nurse, RaDonda Vaught, here's her photo. She was later fired and eventually criminally prosecuted, something almost unheard of for medication errors. And that sparked massive debate. Should a nurse go to jail for a mistake? Or was she just the scapegoat for a broken hospital system? So what can you do as a patient or a family member? The most important thing is to ask questions. If someone's about to give you a shot, a pill, an IV, always ask, what is this for? Just that 1 second could save your life. I'm Susie, your pharmacist, and I share real life stories like this to help keep patients safe. If you want more cases like this, hit subscribe, because before you pop a pill or take any medication, you should always know what it is.